Good evening, everyone. My name is Annette Campbell Anderson, and I am the Deputy Director of the Johns Hopkins Center for Safe and Healthy Schools. I am also the faculty lead in the School of Education for the School Administration and Supervision Program. And I am a member of the Johns Hopkins HEAT team, Health Education and Training team. We are a core of health literacy ambassadors. And we're excited this evening to bring you a webinar entitled Omicron and the Schools. We have with us two fantastic guests who are here to give you their insights about where we are in this pandemic and how it has affected our children, both in schools and at home, as well as in the community. And so we are so excited to bring them here. We are so excited to have you as our guests here with us this evening. And we're going to start with my introduction of both of our guests. So our first guest is Dr. Patty Wilson. Dr. Wilson is an assistant professor at the Johns Hopkins University School of Nursing. In her faculty role, she serves as a clinical coordinator for pre-licensure nursing students during their psychiatric clinical rotation. She also teaches in the psychiatric mental health nurse practitioner postmaster's certificate program. For her faculty practice, Dr. Wilson is the site coordinator for doctoral nursing students working as community health nurses at the House of Ruth, Maryland, a shelter for individuals and families escaping intimate partner violence. Dr. Wilson is also the co-principal investigator of the Passport to Freedom program, which provides psychoeducational sessions for women to promote self-awareness of the link between trauma and health and offer strategies to cope with symptoms of trauma and stress. Dr. Wilson completed her doctoral in psychiatric mental health nurse practitioner studies at the University of Virginia School of Nursing. Her dissertation focused on the relationship between housing instability, race, ethnicity, depressive symptoms, and increased exposure to IPV among mothers. Dr. Wilson works as a PMHNP at Families First Counseling and Psychiatric, a Baltimore City community-based behavioral health clinic. Welcome, Dr. Wilson. It's good to see you.
Thank you very much for having me here. It's a pleasure to join the town hall today on this very important topic. Today, as mentioned, I'm faculty at Johns Hopkins School of Nursing, and I'm a psychiatric nurse practitioner at Families First Counseling and Psychiatry. And so today I'll be talking a lot about the experiences I've had with seeing people or either parents or teachers or even children who have been exposed or have been impacted by the COVID pandemic. So you can have some idea of how things are as far as the mental health is concerned. So again, it's a pleasure to be here.
So happy to have you here today. Awesome. So our next panelist probably needs no introduction because he is our resident cut up, but he's also our resident genius. And he has really been on the front lines of this pandemic since the very beginning. And it is his insights that really brought us together to form the HEAT core team. I'd like to introduce Dr. Panagis Galiatsatos, MD, MHS, who is an assistant professor at the Johns Hopkins School of Medicine in the Division of Pulmonary and Critical Care Medicine. He is co-chair of the Johns Hopkins Health Equity Steering Committee and is the co-director and co-founder of the novel medical initiative, Medicine for the Greater Good. He has published over 40 research articles with a focus on health equity, community engagement, and contextual level variables impact on health outcomes. During the pandemic, Dr. Galiatsatos and colleagues coordinate community engagement to assure all populations are able to access COVID-19 updates and resources in an effort to assure compliance with public health requests. We're so excited to have you here, Dr. Galiatsatos, or Dr. G, as you're commonly referred to. Welcome this evening. Thank you for joining.
No, a true honor to be here with you both, in addition to the families that are listening in. And you know what I promise to provide over the next hour, along with my colleague, Dr. Wilson, is just a sense of understanding how to handle the consequences of the pandemic, as well as how to assimilate with this virus in an effort to not let it be so disruptive to our lives. We have the tools, just knowing how to use them appropriately. So excited to be here. Thank you so much.
Absolutely. So I'm just so happy to have both of you here. As I said, both of you are very dear and near to my heart. Dr. G, I've worked with you for so long through this pandemic. And Patty Wilson, who's my sister in a lot of ways. We share a lot of bonds, some red and some white. And so it's just really good to have all the people I care so deeply about in this conversation today. So thank you for joining. I'd like to start this evening with just asking you to give us a general state of where we are. I mean, I go back to March of 2020 and I think about March 13th, that Friday when we thought, okay, we can all do this. We can buckle down for 2 weeks and we can get through this. Our kids will have an extra week of spring break, but we'll be okay. We'll tunnel through. And now here we are. And actually, this is what we're year 3 of this pandemic. Dr. G, can you start by giving us some insights on like where we are and why it has continued? This pandemic has just continued to defy what experts have said would be a short-term pandemic and what is now becoming more endemic.
Yeah, no, and happy to. And, I think it goes to just a recognition, Mother Nature has her own pace. We hope for the best, right? We maybe a week, maybe 2, maybe a few months. How much seasons of Tiger King can we really stream on Netflix and then, so forth. So, from that standpoint, I think we have all become humbled by, getting control of an airborne virus like SARS-CoV-2 that results in COVID-19. It's tough, and more so because not just the science, but the humanity of it, right? So where we're at in the state of things, one thing I love coming in and answering this question is we have the scientific outcomes to knowing how to end this pandemic. We've put this virus under the radar, under the microscope of how does it spread? And we've figured out, even with the newer variants, how to stop that, from physical distancing, monitoring your spaces, and recognition that the face masks work. We know how to not spread it if we do happen to catch it, right? And appropriate contact tracing and so forth and testing. And we also know how to keep it and when I say a cold, I'm not trying to take anything away from the people who, suffer from a bad cold, but how to keep it from being life-threatening. I mean, and the vaccines are one of the massive tools to do just that. So we have the tools to contain this and keep it so it doesn't disrupt our lives. And that's one of the things that I love to be able to come. At the same time, making sure those tools are understood and making sure there's confidence in those tools is a different component. And that's why we're here with you all, to give you that confidence in order to do what you can to keep your families safe and sound, and allowing our children and our families and so forth and teachers the peace of mind that you can engage in school activities and so forth without a fear of COVID-19 stealing the health or quality of health or lives of your own family. So from that state, we have the tools. And as a physician in the intensive care units, I see it firsthand. My heart goes out to all the patients I care for with COVID, but the big change, the drastic change between now and when the pandemic started happening is that many individuals come into the ICU, well over 90%, are those who haven't gotten the vaccine. And my heart breaks because it's like we could have reached them, if we had more engagement and more conversations. And at the same time, their management as we can in the hospital, I always tell them, and just to you all as well, and I'll close with this pandemic won't end in the hospital, right? If you're sick coming to me in the hospital, it's a different conversation. I'm there to save your life. This pandemic actually will end in your homes, right? The more you do to not catch COVID, to not spread COVID, and to keep it contained, you guys, everyone, all these families, you're helping us end the pandemic. And I'll tell last thing to the families, when we go and engage with your schools and your children, we tell every child they're about to be a hero every time to help us stop COVID-19. So that's it. That's where we're at. We got the science. Right now, it's all about the community engagement.
Awesome. Thank you so much, Dr. G, for that update. Dr. Wilson, let's talk a little bit about how mental health has become really central to the conversation that we're having about the impact of COVID, because far beyond the medical piece of this, we know that, the mental health side of this has affected our children. It has affected our families. It has, gone beyond just affecting patients in the hospital or families that are directly affected by this, but it's really affected a whole generation. So how would you say that, we are dealing with the mental health impact of COVID right now? And particularly, what are you seeing with how it is impacting our young people and our children?
Well, it's the biggest thing is that it's this change that we're going through. This is for across the board for everyone, for parents, for the teachers, for our students, the little ones. This is something different that they're not used to. So we're all a little uncertain, not at ease, not sure what to expect. This is our first time living through a pandemic. So, and I think we need to have a little bit of self-compassion with that, to know that it's okay of the uncertainty. I think my cat wants to be involved, so apologies
we
for
love
that.
to see pets and children.
Likes to
So
be
this is a
part of
family
the-
show. It's a
I
family
shut
show.
the door and everything, and she still came in. So my apologies. But so I think the biggest thing is to understand that it's okay to be uncertain. It's okay to be nervous. It's okay to be unsure what to expect. So that's why communication is important. That's why being able to know where you're able to get the correct information about the pandemic, because that's the hard thing too, is that it's so much information that's out there that it can get really confusing. You don't know what to believe. And for now, if social media is really something that people are getting a lot of their information from. We're getting different things from word of mouth. You're hearing from other people. My cousin's cousin had this, or they said that. So it's really who are you getting this information from? So as far as with our kids, it's an adjustment. We went from completely being home, so you're used to being in person, to now all of a sudden it's completely virtual. So that's a whole adjustment. And then you have the parents. So you have parents that are trying to either help with the school care, help with the learning. It depends on the age. And we talked about this a little bit earlier before the session started. You have to really look at what stage of development the child is in too. Are they able to do self-directed care? Or is this something that you have to have someone that's actually there helping them to understand? And when you're the parent working from home, that's difficult to multitask and do all these different things. So it's been very challenging. And I think the biggest challenge has been it's difficult to get appointments. Mental health, we need more providers, we need more access. So there's a long wait list. So that can be challenging as well.
Yeah, schools are having a very difficult time, even though there's a lot of ARPA money that's flowing into schools from the federal government. My understanding is that schools are having a dickens of a time trying to find providers so that they can provide mental health services to our young people.
And what we've noticed too is that people that may not have been in getting behavioral health services before now are in need of. And so it's easier for those who are already in care because they already had a provider. But when you're talking with someone who needs a new provider. So, and then we're thinking about how it crosses the board with everyone. So the therapists, they may be overwhelmed. The prescribers, the same thing. So it's definitely something that we all had to have an adjustment to.
Thank you. Thank you, Dr. Wilson, for sharing that. I want to bounce back for a moment to you, Dr. G, to just ask you about where we are with the vaccine in our youngest children. I saw a statistic on Sunday in the New York Times that said that while about 50 and the 50% of our young people who are aged 12 to 18 have gotten the vaccine, amongst 5 to 11-year-olds, that percentage is only about 17%. And all of this came right as Omicron really surged. And so a lot of parents don't know whether it's worth it to get the vaccine. And so, I'm wondering where are we right now with this vaccine for our youngest? Because some parents are tearing their hair out because they keep having to go into quarantines with their young people. And so I am also going to interrupt myself to say, if parents, if the participants, if anyone who's joined us this evening has questions, please drop them in the Q&A. We'd love to ask your questions to our panelists as well. So please ask your questions, put them in the Q&A, and our team will get them and make sure that we see them so that we can answer them. But Dr. G, just going back to that question, I'm really curious, so many parents have just expressed just exasperation. They've had to quarantine multiple times. I've seen, some of my colleagues have said they've quarantined 3 times in the last 3 months. And so it just becomes such an interruption for them to keep having to do this. Tell us, where are we with this vaccine for our younger children? And what should we be doing to encourage more people to get their younger children vaccinated? Because some parents are just now saying it's not worth it. It just isn't worth it because people are getting Omicron despite the vaccine. So.
Yeah, no, and this is a great question, Dr. Anderson. I love this. And so I'm gonna tackle it really with 3 kind of objectives towards this. And I promise you it's all gonna make sense at the end. First is always a recognition that the vaccine's not intended to not catch the infection, right? The vaccine's purpose, the way it was studied, was if you do catch it, can it stay mild? Can we keep COVID from actually causing you the need to be hospitalized and suffer potentially from dying? So that's the intention of the vaccine. It's not intended to keep you from getting infected. That means the catching infection is a whole different strategy, right? That's where face masking is appropriate. That's where making sure you're making the right decisions about who's coming into your home if you're going to let your guard down when face masks come out. That means having a public health conversation. Is it worth going to indoor dining and drop the mask in order to engage there? So catching COVID is a different conversation. And I agree, right? We're seeing a lot of people catch it as we're trying to build this plane and fly it at the same time with regards to how do we assimilate it to the public. So I make that case because just because people are catching it does not mean the vaccine's not working. The vaccine's job wasn't to prevent that. It was to keep it mild if you do catch it, right? Mild meaning out of the hospital with your life intact. Now, with that said, parents, just like, it's a great question. Is it worth it, right? So once we reframe what the intention of it is, now let's go back to, is it worth getting our children, the youngest ones, getting them vaccinated? So first, let me come from a safety question, right? Because you want to make sure the benefit far outweighs the risk. And from that standpoint, I can tell you this is by far one of the safest things that we have ever created in modern science for our children. First of all, when the vaccines are created, we're going to do it in adults, right? Research about 50,000 of them, and then let's see real world examples to make sure more rare things don't pop up before we even give it to our children, right? The adults go first. You saw it incredibly safe in adults. I mean, adverse life-threatening events occurring in about 1 in 6 million. I mean, that means from that standpoint, it is safe. I mean, you're more likely to win the Mega Millions than suffer one of these rare, serious adverse events. So safety was by far there, and the research trials showed that. Okay, so it's safe. Now the benefit. Now, this is the part that I really want to emphasize. We cannot sit back and look at numbers, because we as a society made a promise to protect every child's life, especially from a preventable disease. Severe COVID is a preventable disease, right? So when I hear these numbers about, well, it affects more of the elderly, yeah, that's diseases in general. More elderly get cancers than children, right? More elderly get infections than children. That's nature, right? That's why we build one pediatric hospital, dedicated pediatric hospital, for every 50 adult dedicated hospitals, right? Yeah, kids don't get as sick as adults. At the same time, we as a community, as a society, have made this pledge saying there is a rate of preventable disease that is no more. We can't do that. We did that with measles, we did that with polio, we did that with smallpox. Severe COVID-19 rivals those diseases, if not more, right? So let's stay consistent. As a society, we've always made a pledge to prevent those deaths. And I say this because if you talk to parents who have lost children to COVID-19, you can't shift their mind from a denominator and like percentage-wise, it's one child, and that's one child too many. So yes, is it worth it? 100%. You know, I say this as a physician, I say this as a scientist, but I say this as a dad, right? As a human being with you all. So COVID, the vaccines are safe and they play a role in keeping our children safe, which also means they get to play a role as a superhero to helping us end a pandemic. So yes, that's how I would approach it. And it's by far consistent with our pledge to our children as a society, because what we've done with prior diseases.
Thank you, Dr. G. A reminder to our audience that we'd like you to type your questions in the Q&A or to text your questions to 22333 and type JHUWL, W as in women, L as in lady, in the message. I'm going to shift back now to you, Dr. Wilson. So there's been a lot of discussion lately because this pandemic has continued to rage on, that our young people have really borne the brunt of the emotional scars of the pandemic. And so a lot of people have started to wonder because we've seen enrollment dropping in public schools, we've seen academic scores dropping as well. We've seen all kinds of markers. Suicidal ideation is up, depression rates. I've seen a number that 41% of high schoolers have now said that they are depressed. What should parents be doing for their children and for their teens to help them to develop the resiliency that we are going to need to make it through to the other side of this pandemic? There's so much that we just don't know. We don't have an end date. There's no one saying that this is going to be over very soon. And so what kinds of coping mechanisms and skills should parents be trying to build in their children and their teens as we are working through this? Because we both know as mothers that, we've seen our own children come through this. We've seen some things, we've talked to them about some things, and, they're talking to us. I think I'm happy that my children do feel comfortable sometimes talking to me about things that they're seeing and experiencing. And so, a little bit of my worry is, they are not having the same kind of teenage experiences that I had. And that, because of all of the masking and vaccine requirements, there's some places that we don't go or we don't go as often. So I just want to know, what would you say parents should really be doing right now? Because, many parents are exhausted. We're exasperated. We don't know what to do. Is school open? Is school closed? Do you wear a mask? Do you not wear a mask? It has become such a political hot button in our communities. How can parents help their children to be more resilient?
I think one of the biggest things is communication, is just to be able to allow them to have the opportunity to share their feelings. And I know it depends on the age group, because I have teenagers too. They may not necessarily want to talk to you, but you still are able to let them know that you understand where they are and what they may be feeling at this time. And then it's a matter of seeing if there's a different way that they can still interact with their peers. So there may be some things that they are still able to do. Depends on, like, even now there's some sports, if people are playing sports, or some extra activities that they're able to do, curriculum activities they're able to do, that still are able to social distance. They're still able to have their mask, but they're still able to be engaged with others, because it's a matter of being able to still socialize. Mm-hmm. And I think that's the biggest thing right now, is the feeling of being bored and being isolated, and not having that ability to interact with others that they were used to. So it's figuring out a strategy of being able to still do that in some sort of way. It's a little bit less stringent as it was earlier in the pandemic. That's when it was really hard, when everyone was at home. We got a lot of people where the major complaint with the young kids was that they weren't able to do any of those extra activities that they did before. So having that opportunity now that they still can go out in public, and as long as they're social distancing, has been helpful. The other thing is for parents to be able to be aware of signs and symptoms. So if they can look, if you have a teen that's now sleeping more often, they're not really engaged in things that they used to be. They may be, sometimes it's a lot of irritability. Again, I know how teens are anyway, but it's above and beyond irritability. And that's why you may see that they're angry more often. They may have a change in their appetite. So you're looking for those signs and symptoms that they may have depression. And that's when you seek help. There's also a lot of hotlines that people can go to if they want to be able to talk to someone, and you want to be able to tell if they are at risk. If you can ask, are they having thoughts of hurting themselves? or if they ever think about that. So you want to ask for those suicide risks. Absolutely.
Yeah, thank you. I just, I know that we are really dealing with a lot of just very unique scenarios that people are confronting. I want to thank everyone who's putting their questions in the Q&A, people who are texting their questions to 22333. And so we are monitoring those. We're going to start in about 5 minutes. We're going to start asking those questions as well. We've got some really great questions, very unique questions. And I think part of this challenge is that so many people were just, it's overwhelming to have to deal with this on a prolonged basis, that not only are our young people dealing with the mental health pieces of this, but it's also important for families to try to deal with this. I mean, families were separated. I know last year at Christmas, we had Zoom on Christmas in my family, and that was incredibly hard on my parents in particular. And so because, family life is so important to all of us, trying to figure out how we keep our families engaged and keep family life really connected, it's also been a challenge for many parents to try to figure out. So I do want to thank you for your response about that. So I want to just go back to you, Dr. G, and talk a little bit about the way that Omicron seemed to hit our schools in a very different way than prior variants, including Delta. So, tell me a little bit about what was unique about Omicron, and why did it just seem to be just so devastating to our schools, and it just upset the whole reopening of schools coming back into the new year. And there's been so much political, just upside down from our school administrators, politicians. Everybody's been weighing in about open schools, closed schools. And so what was it about Omicron that really took people by surprise? And is this possible to happen again this spring or in the future because of the way that the variants are and the virus continues to mutate?
Yeah, no, great. These are great questions, Dr. Anderson. And I love that we're talking to the families here. So hopefully this analogy sinks in. So understand, every biological thing, when it makes offspring, there's always going to be a genetic change, right? So your children are technically, mutations, right? They're variances. They're still humans, still the same species. So when we talk about variances, it still is the same virus, SARS-CoV-2. It just means that some of the genetic changes that we've picked up concern us, right? They're either going to make it easier to spread, they're either going to make it more lethal, or potentially may undo all of our interventions meant to protect us, such as the vaccine. Meaning, every time, think about it, every time a virus finds a new host, when it leaves, it's mutated, right? It just depends, are those mutations really clinically significant to us? If they are, we call it a variant. So right now we're up to Omicron. And what Omicron got us, not off guard to some extent, but, I promise you there are good physicians and scientists constantly thinking of the worst case scenario. The challenge is you can think of it, can you prepare for it at the same time? Omicron hit this notion of it, with its genetic mutations, was easier to catch. Meaning, we always have these models like, all right, 15 minutes, no face mask, breathing in someone else's air, they're breathing out, close proximity, then you catch the Delta. Omicron, we think it happened much sooner, a few more minutes, closer proximity, easier to catch. And that concerned us, right? Because if it's easier to catch, then suddenly you sit back and say, well, what is it going to do to people? And this is where it became really clear that an easier to transmit virus is much more of a burden on a healthcare system than one that's more lethal. Why do I say that, right? So if you think of Omicron and Delta, Omicron hit probably 10,000 people in the same time frame that Delta may have hit only 1,000. Well, if only 30% of the Delta got into the hospital, that's 300. But 10% of Omicron, that's 1,000 of 10,000, right? So that's huge. Omicron's easier transmissibility got more people infected and found more vulnerable individuals in order to become lethal or become really significant where they needed hospitalizations. Now, I say this because Mother Nature is showing her cards. She's going to keep evolving this without any, I'm not trying to anthropomorphize Mother Nature. She's not, she doesn't have a end game for her. She's welcome to make more and more changes that may be beneficial for the virus or not. That's just how evolution goes. What we can do, though, is tell Mother Nature, no, we can control this. And I mean this, the purpose of the vaccine, right? At the end of the day, I already said, it's meant to transform COVID into something that is not life-threatening. That means we put the evolutionary pressure on this virus to just stay calm. And that's key. I've always emphasized this, lead into the pandemic, having a strong immune system is not the key. It's having a smart one. And we've known that for the last 80 years by creating vaccines in order to make our immune systems smart, in order to be there if they find a virus to fight it off. It's like the Baltimore Ravens. They can go to the gym all week, but if you don't know who they're going to play Sunday, they're likely going to lose. So having a playbook is key. And we can put the evolutionary pressure on this virus to say, you stay like this. No more variances. That's it. Because newer ones, if you guys want to keep learning more Greek letters other than just looking at my name, yeah, it'll come by more and more viral spread in unvaccinated communities and so forth. So we have the ability to stop it as is. So that's going to be key. And that's one of the reasons where we're going to emphasize our amazing young children to also get the vaccine, just like we had them do with polio and smallpox, right? If we never got the kids to get those vaccines, those two viruses would still be alive and well, right? Because viruses don't care the age group. They're going to find unvaccinated immune systems to tackle and do their thing. We stopped it. So from my standpoint, if we don't want to learn any more Greek letters, we have the capability to stop it where it is. And that way we don't have to think about any worst case scenarios. Because I'm telling you, the worst one right now that we are talking in preparation for is if we get the next variant to have the transmissibility of Omicron and the lethality of Delta. If you get that, I mean, we are going to be rocked again. So let's stay ahead of Mother Nature. Let's do that.
So we've got a lot of amazing questions in the Q&A. I want to continue to ask people to put their questions in the Q&A. I want to start with a couple questions that I've already received. So just very quickly, Dr. G, how effective is the vaccine for these new variants? And I know that they are currently testing a new vaccine for Omicron particularly, but are we going to see more variants? And are there new vaccines being made particularly for certain variants?
Great question. So what we have realized, back to the alpha, the original SARS-CoV-2, that the vaccines that we created for that still effective. The catch is you need to have it recently with that surge. So meaning you want as many antibodies present as possible. So if you got your vaccines, 5 or 6 months ago, get boosted. Because what we know is the more antibodies you have, the more protective it is going to be against the newer variants. And I promise you, even if we hear, well, it's 90% to 80%, as long as it stays above 50% and more than 50% of the population has it, we're still in good control of this virus. So the vaccine from the original one, still good to go. At the same time, you're right. The pharmaceutical companies are going to look to make variant-specific ones, and that's needed, right? They were doing that with Delta. Now they're doing it with Omicron. I say this because the other fear that we have is if SARS-CoV-2 throws a variant that actually really transforms it into a new species, a SARS-CoV-3, well, if we keep up to date with the variances, the next vaccine is going to be that much quicker to make. So I applaud the scientists working on the variant-specific ones. We may need that, kind of like a flu-specific variant every year. We may need that. Time will tell, but right now the vaccines that are currently available that were made with the alpha, those are still great, especially with the proximity towards a surge. So if you haven't been boosted in the last 5 to 6 months, let's get boosted.
So that actually is a great segue to my next question. A participant, one of our attendees this evening asked, why do I feel drowsy after getting my booster?
Yeah, so keep in mind, right? So I say this is not to take away or minimize anyone's symptoms after the vaccine, right? I felt lousy. My own wife took 2 days off of work, just to recover. But I always say this, right? Getting healthier is fascinating, right? Because, I tell this to patients. What if I could promise you health and it's going to come with a lot of sweating? You're going to get short of breath. Your muscles are going to be pained. They're going to be aching. Almost every patient's like, I don't want to do that. I'm like, that's a bad Pilates class, right? That's like going on a Peloton for about an hour, right? Getting healthier means challenging the body. It's going to have some symptoms, but those symptoms end up going away and the benefit is rock solid. Vaccines have always done that too, right? They rev up your immune system and they can cause some level of fatigue afterwards, right? Just like, a good Pilates class and its ramifications. So those are usually normal, and they tend to last for about 72 hours at the longest. Now, if it is extending more, touch base with your healthcare professional so they can make sure they can work you up to make sure nothing else is going on. Because I say this because sometimes it could be cause and effect. Other times it could just be a random correlation that occurred at that moment. So just, after 72 hours, if a lot of symptoms are still lingering, talk to your healthcare professional just to make sure nothing else is going on.
And so to follow on to that question, Dr. G, how can you differentiate between COVID and the flu? Because I know that, with Omicron, the number one telltale symptom was a sore throat. And so for most people, that would not necessarily seem to be the same as what we were seeing earlier in the pandemic when it came to symptoms for COVID.
You're right. I mean, Omicron symptoms definitely pivoted from its predecessors, and let me say this. I should have started off with this disclosure because I said it March 16th, 3 days after the 13th of 2020. Hey, whatever I say now may be wrong later tonight. I still tend to say that with the pandemic, maybe not as frequent as I should, because you have about 2+ years worth of data to reinforce. But this is a big pivot. And I think, look, I think 3 reasons allowed Omicron to spread. We had the genetic potential. It was there. 2, don't forget, we had the holidays. I mean, Mother Nature, it's like she's writing the world's worst Greek drama, right? I'm going to give you the most transmittable virus at a time where people want to gather. 2 years into the pandemic where there's also fatigue, right? People are going to want to get together with the ingredients. And then that transmissibility occurred with very non-specific symptoms. Like almost every patient I talk to, right? When they tell me, they're like, oh, I thought it was just a migraine headache, a sinus headache, sore throat. I thought it was just because I was screaming at the Ravens one Sunday. These are very non-specific, and not just non-specific, they're very dismissive because they're not ones that you would think are prone to, are coming from an infection. So that's challenging in of itself. And, navigating those waters, I can't even say to you as a physician, it's easy to do. It's not. They're non-specific. And the other part of the non-specificity is there are oftentimes symptoms of dismissiveness, right? It's my usual sinus headache, et cetera. So what I would plead to the community, and I'm going to say this now, I lacked the confidence a few weeks ago because, I'd be like, well, get tested. Well, yeah. And then they said, well, where do I get those tests from? I get it. Now, to some extent, we've seen great efforts from our own city's health department and a variety of other health systems, make sure we can get you all access to these tests at home. So if you have any symptoms that deviate from your norm, right, where it's like, all right, I do have a sore throat and the Ravens weren't playing, right? Or if it was, I have a sinus headache, it feels a little unique than my typical ones. That's where I would stay on a heightened alert about just do some testing. The other part about the testing is what's the likelihood it should be positive? Because if you're doing these tests with those symptoms and someone called you and is like, hey, we hung out Monday, I just tested positive for COVID. Suddenly those symptoms and your exposure raises your chances of being infected. So that's what I would say, right? With those kind of get testing with those symptoms, and especially if you had a known exposure. But Dr. Anderson, we can't really differentiate between the two. They're very non-specific. I would say for Omicron, just stay more heightened alert for more upper respiratory symptoms, sore throat, sinus headaches, runny nose. Stay on a heightened alert, especially for the kids. They're going to be much more prone to those than anyone else.
Thank you. So I want to pivot quickly to you, Dr. Wilson, and ask a question about the rates of suicide ideation. Are we seeing more rates of suicide ideation because COVID just continues to persist? Is it because our young people have been disconnected from their friends and their communities for longer than we expected? Is it because social media has just played a role in just advancing this notion that everyone is perfect and beautiful all the time and that their lives are completely worry-free? Why are we seeing these increased rates of suicide ideation, and what should we be doing about that?
I would say all of the above. Definitely all of the above, because when you're thinking about the isolation that we talked about before, not being able to interact with others like we're used to, and just this constant change. And we, children, and we sense what's going on. They sense what's going on with their parents. They sense what the teachers are feeling. They can feel what's around them. So if the teachers, if the parents, if everyone around them is feeling anxious because this is the unknown and things are changing so much, that can make a child feel anxious as well. And then the isolation and being really, it's a more time with social media. It's more screen time that they're doing now. So it's more opportunity for them to see different things that are on social media that can have an impact on them. So depression has definitely been a lot. It's been higher rates of depression, higher rates of anxiety, higher rates of self-harming. A lot of children do things like cutting, so that's self-harming. So we'll see rates of that as well. And then acting out. So what we've noticed as well, and this is more, I'm not sure if the statistics with this per se, as more of like things that I've seen clinically, is that when it is time now to go back to school after being at home, that it's harder for them to adjust to now having these rules that go along. It depends. You know, you're also talking about parents that may be working as well and still trying to struggle with working, taking care of those responsibilities, as well as helping to homeschool the child and the responsibilities that go along with that. And then when they get to school, then it's a time for them to go back to that structure. So it's really important for children to have that structure outside of school. So have a time that's for home, so they know what the routine is at home, and then a time to know what the routine is at school. But when it's mixed together and it's that blurry, like I'm not sure what is going on, that can cause for behavior, a change in behavior. Yeah. And so and it's definitely an adjustment period for that. So again, it's
I'm sorry, go ahead, finish. I'm sorry.
No, I was just gonna say, as far as suicide is just, again, making sure that you're noticing changes in your child and noticing changes in behavior, if they're more withdrawn, if they're sleeping more, if they are angry. If you notice, you want to be able to talk to them and have that open communication with them and seek help in that case. Yes.
I think it's, you know, you're pointing to a lot of the things that parents know that we should be doing, but it's also, we have to remember that this pandemic is affecting us side by side. Absolutely. At the same time that it is affecting our children. And so many families have been impacted by COVID. You know, we have seen, you know, the national president of our beloved organization just lost its leader. Oh my goodness, what a shock that she will be memorialized this weekend. And so, you know, the pandemic is still, you know, raging, and we're still losing people. The vaccines are helping. But I think that, you know, for parents, they're trying to manage their own emotions, even as they are trying to help their children. So I think we have to acknowledge that everyone is doing the most that they can. And that this exhaustion is unique to anything that anyone has ever experienced. There's no precedent for it. There's no guide. And so we have to counsel love and kindness and patience and distance, because you need some time to just absorb these things and not push yourself too far. I think that's one of the things that, as I hear you talk about some of the symptoms that you're seeing, you know, I think we rush to try to fix everything. And this pandemic has humbled us because we don't have answers for things that we think.
That's a really good point, because it really made us rethink about life and rethink about what's important in life and put things in perspective. And really, I mean, it's changing our world. It's changing workforce. It's changing how, I mean, some jobs are now either hybrid or completely virtual. Not everyone has an opportunity, though. We have a lot of people that have to go into work. So that's where those challenges are. And again, that's very stressful, because then you're dealing with childcare. So where are you going to find, if you have to go to work, but the school is closed? So what do you do? But you still have bills to pay. So there's a lot of challenges that individuals are facing. So it's a difficult time. And like you mentioned before, this is new to us all. This is, we're all adjusting in itself. Is compassion. It's having compassion for ourselves and understand that we can only do what we can do. We have to, make a plan,
Yes.
plans change at times. So you have to be flexible with that, but then understand that it gets frustrating, but we have to be careful to make sure that it's not affecting our health, our mental health. And so you look at the bigger picture of it all. What can I handle at this time? What can I take care of at this time under
I
these
think
circumstances?
that's an very important point. And I'm so glad you made that point. I think it's important for parents to find communities to share because
Right.
there is no guide for this. I spoke to a group of principals just this week, and it's important for people to realize that principals are going through this as parents, they're going through it as daughters and sons worried about their parents. They're going through this as community members, and they're going through this worried about their staff and worrying about their students. And so, they are also exhausted in a unique way in this. And so we have to find the safe spaces where we can take our heads off and share that exhaustion and encourage each other. It's important to do that in this pandemic. I want to note that one of the parents that posted in the chat in the Q&A talked about her own exhaustion. She's ready to throw her hands up. She says that her school system is anti-mask to the point where they are trying to not even require that students wear masks after a 5-day COVID isolation. Mike, and we know that those isolations used to be 10 days and then suddenly they became 5 days. It's like the social distancing in schools was supposed to be 6 feet and now it's suddenly 3 feet to no feet. So I know that for some parents, they are just trying to deal with these constant levels of changes. And so this parent writes that my children are both double vaccinated and they have still gotten COVID. So that's the other frustration for many parents, that they've gotten their children vaccinated. And some of these families are still saying that their children have gotten COVID. So this mother is asking a question. I'll post it to you, Dr. G, but then also Dr. Wilson to speak on just the frustration of it all. Dr. G, this mother is asking, should I insist that my children wear their masks at school because they don't want to, because their friends are not wearing masks at school?
Yeah, no, and I'm sitting here as not just as a doctor, but as a parent. I mean, you guys are, everyone's spot on. Like, I mean, the science is put out there, right? I got to make this emphasis. Science is just objective truths. We've got to take those objective truths and understand how can we apply them to our daily living, right? And we know how to not catch it, we know how to not spread it, and we know how to prevent severe disease. And I say this because the vaccine's role is the latter. It's the last one, it's preventing severe disease. It doesn't stop you from catching it, no different than, a bike helmet doesn't stop you from falling off the bike. And so from that standpoint, I would emphasize face masking to be a consistent key element. Why? Because you don't want to catch the kid for all the reasons Dr. Wilson mentioned, right? If you catch COVID, they're going to still ask you to stay at home. So great, the vaccine's working, you're staying alive, you're enjoying some days off, but you're away from school, and that's going to disrupt lives, especially if people need to go back in. And so that's the part that always, we can be in school safely with face masks, right? It's not, it's a way to assimilate with this virus without it having disrupt our lives. It's a minor inconvenience in order to allow us to have these school engagements and so forth. So I see this because it's easy for me to, that parent should try to emphasize that. The challenge is that they're going to come across, and this is where I imagine she's, screaming at the walls, or he's screaming at the walls, is feeling like you don't have a control over that. So you can advocate for your child to do it, but your child's still going to come across, students who aren't wearing it. And so that fitting in process, this is the part that really I find challenging. My heart goes out to you. I find challenging. I'm going to, the best way to not catch the virus is making sure the schools communicate with their families to not bring it in, because that's how it spreads in the schools. Someone has to bring it in, and recognizing that the face masks are to me, the best weapon to not catch it. And so in a time where we still have a heightened amount of Omicron, I know the cases are falling, but we're not out of the woods. All we're doing is just seeing the light at the end of the tunnel. I would say, a few more weeks and then we'll be out of this, this peak. And so I would say at that moment, face masks are going to be necessary. That's part of the adaptation process. They're not permanent. We'll move in, move out without a complete need to shut it down. That's what my emphasis would be in order to kind of adapt in the appropriate way to keep people safe, right? And just like Dr. Wilson, I'm going to pivot now to you, because that's key. It's not just about saving your life. The vaccine did that. But the face mask's job is to keep you from catching it so you're not disrupting your lives. Over to you, Dr. Wilson.
Right, I completely agree. I mean, it becomes a challenge. So I don't know the age of this child, because that can be some strategies depending on the age of the child that may, be able to help the child be able to want to wear the mask. But then when you talk about when they're older and you're talking about peer pressure and potentially bullying, it makes it kind of difficult if they're the only one that's not wearing a mask. So I do understand how challenging it may be for the parent in that case. I think that's unfortunate because, I mean, it sounds like that's from the top down, talking to the school system there, the teachers, the principal, and seeing if more people, or if there's more parents that are interested in their children wearing masks, and maybe that's some type of way that those kids will wear masks. But I can imagine how difficult that is. And I'm not sure what other precautions they have in place for children in that particular school. But that is definitely a concern.
It is because it has become so politicized, as we know. We've seen how politics have completely, in Virginia, I know that the governor recently declared that masks were no longer mandatory. And so, even as some local districts have reinstated the mask mandates, there's a lot of push and pull to this. And it's veering into our national politics, as we all know. And so, for parents who are caught in the middle of just wanting to keep their children safe, this has become such a difficult and highly politicized. I mean, like you said, Panagis, there's a science to COVID, but then there's the politics of COVID. Then there's also the social emotional piece of this. And so parents are really between a rock and a hard place, trying to keep their children safe, trying to make sure they're in settings of care and of learning where they're going to be protected. And so, I just think that your insights on this are so critically important at a time when parents, as a mother said, she's just ready to throw her hands up because who knows where to go.
And I want to add, sorry. I just want to add to that. Oh,
Dr. Wilson, you go, Dr. Wilson, Dr. Wilson.
So I just want to add to that for the parents. Self-care, the whole thing of putting your oxygen on you first before you put it on other people. So it's really important for them to take care of themselves and their mental health. It means for them to get their support system, if it's other parents that they can talk to, if they are in need for therapy, or if they need any type of other type of behavioral health. And that will in turn help them to be able to care for their children as well, because it's difficult when they're stressed out. So I definitely would think about having some self-care or some strategies to help them during this difficult time. And that's for all of us, not just parents, that's for all of us.
And
I'm sorry.
I'm going to add, this is coming as a lung doctor, but the sheer frustration about the politicization of face masks, this is where I'm alluding to. There are patients, pediatric kids, who've needed to wear face masks in order to protect themselves from germs. And there was a mother who wrote this beautiful story that was published at the Cystic Fibrosis largest website. And she goes, as a parent to a young child with cystic fibrosis, I've encouraged mask wearing in high-risk areas since my daughter was 1. I took time to explain why we need to wear one and why it protects us. And I say this because the notion of dismissing them, I mean, you're stigmatizing a massive population of parents and their kids who they just want to do the right thing. We should never frown upon people wanting to keep one another safe. And that's just what makes us a society. So just recognize that. And to the mom, I feel that frustration. It's palpable. I'm hoping what we've said today helps you to stay consistent and maintain that grit and tenacity.
I'm watching our time, but we've got a couple really powerful questions and I want to get to both of them. We have a parent who asks, how should I be managing grief with my child? I feel like the past 2 years have been so heavy. And I identify with this because, my husband lost his friend early on in the pandemic to COVID. And it was such a shock because, so that was a shock. we've seen other people who've been, and then we've got this long COVID. So I'm going to come back to long COVID in a moment because that's affecting other people in different ways. But as a parent, how can this parent figure out how to get support? As the parent says, they're not sure what to do, and their children are experiencing grief, as many of us also have had to do during this pandemic. How should this parent deal with this? I'll start with you, Dr. Wilson.
Absolutely. And again, that would be something that really depends on the age of the child, because you want to make sure that you're talking to them about grief in a way that is age appropriate so that they can understand. But grief in itself, it's a process. We're all go through things differently. The actual loss, how that makes you feel emotionally. But what we want to watch out is if it's keeping us from being able to do our daily lives, if it's keeping us from able to continue in school, if it's really having an extreme negative effect on your mental health where you're not able to function. But there's grief, we miss people, we're sad. And that's a normal process. And I want people to be able to understand or accept their feelings, to recognize the emotions, to know why they're there, and to have a process of actually going through that emotion. And that's a normal way of dealing with grief. There are some support groups too. It depends on, and I can give that information. And some support groups that may be appropriate based on the person's age. So they do have support groups for younger children too around grief. So that would be very helpful again, and that's a different way for them to be able to interact with others and knowing that they're not by themselves. And I think that's the biggest thing with a lot of us is we feel like we're in silo, we're going through these emotions alone. But I think nationally, as a whole, it's a lot of us that are going through grief. We're dealing with a lot of this change. And even if it's the grief of not being considered normal, things are not normal anymore. Thought was normal. So that would be very helpful for them.
Thank you. Now I want to get to this other question from a parent about long COVID. I think the narrative about Omicron has been that it's a milder version of COVID, although we have seen that it still is, has been deadly in some cases. It may not have been as deadly as some of the earlier variants. Can you tell us a little bit about what we know about long COVID and children, Dr. G?
Yeah, no, this is I'm in the intensive care unit helping patients, and I'm actually one of the 4 physicians at Hopkins that runs the post-COVID-19 clinic. And over 85% of our patients in this clinic have one thing in common, 85%. All of them experienced mild COVID, right? So that's my biggest fear. Mild COVID just means it didn't land you in the hospital, but the majority of post-COVID symptoms occur in the mildest cases. Now, over these years, there's another variable that's really creeped up. Mild COVID in unvaccinated individuals, meaning this goes back to when we discussed a smart immune system. The beauty of it is it tells you how to fight the virus and it tells you how to heal appropriately afterwards. That's what a smart immune system is gained with a vaccine. Remember, post-COVID was not something the vaccine's intention was. It's been studied and it's shown that post-COVID symptoms, if they exist, they last very briefly if you're vaccinated. So it's another reason to recognize that don't get lost in the language that we use as physicians about mild. It's just meant to denote you're not landing in the hospital, but it's still going to have consequences, as Dr. Wilson mentioned. You're going to be out of school. You may lose days of work. And my biggest fear is, especially in the unvaccinated, it may result in more cases of post-COVID-19.
Thank you. And then this last question, we have about 1 more minute. I'm going to bounce back to Dr. Wilson. So you raised the question about being able to monitor your child's screen activity. And I know that's a big challenge. I have that challenge because you know what? My children have every device available to man. And so I can't manage their screen time. I can't manage my own screen time. So how, as a parent, what would you recommend in order to just try to make sure that there are some safeguards for families to be able to know that their children are safely accessing social media right now?
Again, another thing is age. Remember, it really does depend on the age of the child. There are some apps that will help you to be able to do some parental guards on the app, or for you to be able to see what they're looking at, or check what websites they've gone to. So that would be something that's very helpful. It depends. One of the things that you may do is just have where you are able to have a time when they're finished with their screen time for the end of the day, because sleep is so important with all of us. So you want to have a time for them to be able to turn off social media, to turn off screen time, so they can get the sleep and get the work done that they need to do for the next day. So there's things that you can put in place that way as well. But it really does depend on the age of the child, and what relationship you have with the child as far as communication. Yes, I think that would be very helpful.
Awesome. Well, we've spent an intriguing and exciting hour together. There are more questions that we could certainly ask. We're so grateful to all of you who have joined us this evening from near and far. I want to remind everyone that we will have a Omicron in the Schools Town Hall this Thursday, also at 6 p.m. to talk to our teachers and educators. So feel free to join us again on Thursday. The registration is in the link online. You can follow us on Twitter, on Instagram, as well as on Facebook. We are at JH Heat Core. So please look for us on social media. Please join us. We are happy to take your questions. Again, if you have further questions, we tried to get to as many of the questions as we possibly could. If you have additional questions, you can feel free to email those to heatcore, HEATCORPS @jhu.edu. I want to thank our fantastic panelists, Dr. Galiatsatos, for all of your warm insights and for your accessibility in the middle of this pandemic. Having access to such smart people who are on the front line in this pandemic has meant so much, because we don't know what information we can trust. And so we're so grateful to you. Dr. Wilson, my dear Soror, I want to thank you for joining this evening. It's so wonderful to see you and to have this time to share with you. And thank you for your insights about mental health. I want to say that we have some information about how you can access the National Suicide Hotline in the chat. If you have questions about mental health, if you have concerns, please avail yourself of this information that's in the chat and reach out. As I said earlier, it is important in a pandemic that we reach out and connect to someone else. Make sure that you don't isolate yourself and stay alone. You are not alone. We are all in this together. Connect with someone. Just connecting to one more person could make the difference. And so I encourage all of us to find the kindness and the love and the grace that we will need to make it through to the other side of this pandemic. I want to thank our fantastic production team this evening. There is an enormous army of fantastic people who have helped to put this program together today. And I want to thank you, all of our Heat Core team members, for providing the content and for monitoring the chat with the questions and making sure that today came off fantastically. I thank you. I also want to thank our sponsors, the Johns Hopkins University and Medicine. They have been behind us. And of course, we know that Hopkins has been on the front lines of this since day one. And so we're so grateful to be a part of this incredible institution. It's very humbling to be at Hopkins at such a time as this. I want to thank the Johns Hopkins Health System for their support of the Heat Core team. And I also want to thank our colleagues at Baltimore City Public Schools in particular. So this evening, as I close our program out, I just want to say again, the most important piece of this pandemic is to remember that we are not alone. Find a connection, make a connection, because every connection counts in this pandemic so that we can get through to the other side. Thank you so much for joining us. Thank you so much for your time this evening. And we look forward to you joining us again on Thursday. Good night.